The year was 1381, and the streets of London were a cauldron of rage and rebellion. On Tower Hill a crowd had gathered, their faces twisted with fury and their hands eager for blood. Among them was William Appleton, a Franciscan friar and the personal physician of John of Gaunt, one of the most powerful men in England. Despite his esteemed position, Appleton was no match for the fury of the mob. He was dragged from his horse, his brown Franciscan habit torn and stained, and beheaded on the spot. His death was a shocking moment that highlighted the deep-seated discontent of the common people, who blamed John of Gaunt for the harsh taxes and military failures of King Richard II's reign. Appleton's story, however, is more than just a tale of a tragic end. It is a window into the world of medieval medicine, where friars like him played a crucial role in healing the sick and wounded. From the 13th to the late 15th century, friars in England were not just men of the cloth. They were also skilled practitioners of medicine. Their work was often documented in manuscript books, which sometimes mention the names of the patients they treated and the remedies they prescribed. One of the most important texts from this period is the Tabula Medicinae of 1416 to 25. This manuscript, compiled by Franciscan friars, records the effectiveness of various remedies and treatments. It provides a glimpse into the medical practices of friars like John Bruyll, a Franciscan who wrote his own medical manuscripts, and Richard Tennant, a Carmelite who also left behind records of his healing work. The Tabula Medicinae is especially valuable because it mentions the names of specific patients and the successful cures that friars achieved. But the story of medieval friar physicians is not limited to these texts. The letters of Adam Marsh, a prominent Franciscan and intellectual, offer a more personal view of the medical needs of the friars themselves. Marsh, who was a close friend of the influential Bishop Robert Grosseteste, often wrote about the health of his fellow friars and the challenges they faced. In one letter, he described the severe illness of a brother friar, Philip of London, and requested that the convent provide him with additional food to help him recover. Marsh also recommended secular physicians for high-status patients, such as Master Reginald de Stokes, who was known for his advanced knowledge of medicine. William Appleton's life and career illustrate the complex roles that friars played in medieval society. He was not only a healer, but also a man of the court, serving John of Gaunt with the same dedication he showed to his own brothers in the Franciscan order. His remedies, recorded in the Tabula Medicinae and other texts, reveal a deep understanding of both physic and surgery. He treated a wide range of conditions, from burns and hernias to fevers and eye complaints. Some of his remedies, like the plaster of Venus for hernias, which required the blood of a man of sanguine complexion, were likely reserved for the most noble patients. Others, such as plasters and ointments for pain and skin conditions, were more common and suitable for everyday use. Appleton's role as a court physician also suggests that he had experience in battlefield medicine, possibly accompanying John of Gaunt on military campaigns and treating the wounded. His practice combined the skills of a surgeon with the knowledge of a physician, making him a versatile and respected healer in a time when medical care was often a matter of life and death. The story of William Appleton and the other friar physicians of medieval England is a testament to the multifaceted roles that these men played in their communities. They were not just spiritual leaders, but also skilled practitioners of medicine, whose work left a lasting impact on the lives of those they treated. In the 13th century, the Franciscan and Dominican friars played a significant role in providing both medical and spiritual care. One of the most prominent Franciscan healers was Brother Adam de Betjesovers. His skills were highly sought after, and he was often called upon to treat various ailments within the Franciscan community and beyond. Adam de Betjesovers was particularly known for his expertise in treating serious illnesses. For example, when Brother Ralph of Malton fell ill, Adam Marsh, a key figure in the Franciscan order, wrote to Brother John of Stamford, the custodian of the Oxford convent, requesting that Ralph be allowed to seek treatment from Adam de Betjesovers. Marsh emphasized that Adam's care had been beneficial to Ralph in the past, and that he should be sent to Oxford for further treatment. This request highlights the trust and respect that Adam de Betjesovers had earned within the Franciscan community. Adam de Betjesovers was not just a healer for the friars. His services extended to laypeople as well. Adam Marsh once wrote directly to Adam de Betjesovers, asking him to help Roger de Kirkby, the brother of a friar from the Stamford convent. Roger was suffering from a dangerous illness, and Adam Marsh believed that Adam de Betjesovers could provide the necessary care. The care of the sick was seen as a vital part of the Franciscan vocation. Adam Marsh, in his letters, often emphasized the importance of maintaining good health, so that the friars could continue their work in teaching, preaching, and administering confession. He also reflected on the spiritual benefits of illness, suggesting that suffering could purify the soul and bring one closer to God. Despite this, he was adamant that the friars should receive the best possible medical treatment to restore their health. While the Franciscans were known for their healing, the Dominicans also played a significant role in providing both medical and spiritual care, especially to the nobility and royalty. One of the most notable Dominican healers was John of St. Giles. He was a regent master at the University of Paris, who joined the Dominican order in 1230. John of St. Giles became a close advisor to Robert Grosseteste, the Bishop of Lincoln, and was often by his side, offering both spiritual and medical advice. John of St. Giles was particularly skilled in treating the illnesses of high-ranking individuals. Matthew Paris, a chronicler of the time, recorded that John treated Grosseteste when he was poisoned in 1237. He also treated Richard de Clare, the Earl of Gloucester, who suffered from a severe illness in 1258. Despite recovering, the Earl experienced some lasting effects, such as the loss of his teeth and nails. John of St. Giles's medical practices were documented in various manuscripts. One such manuscript, Bodley MS 786, contains a list of 20 remedies attributed to him. These remedies cover a range of illnesses, including fevers, women's health issues, and surgical complaints. For example, he prescribed an expensive electuary for the Earl of Gloucester, known as risata novella, which included ingredients like roses, sugar, and various spices. This remedy was intended to restore health and strength after a long illness. Another interesting case involves John de Warenne, the 6th Earl of Surrey, who suffered from deafness. John of St. Giles recommended a treatment involving warm nutmeg oil or rue mixed with lard to be inserted into the ears. If there was a risk of an aposteme, a swelling, he suggested a maturative plaster made from agrimony and honey. The Earl was also advised to take aloe pills mixed with myrobalans, rhubarb, and violet syrup in the evening. John of St. Giles's remedies were not only effective, but also tailored to the social status of his patients. For instance, the expensive electuary for the Earl of Gloucester reflected the Earl's noble status. John's expertise in treating deafness and other conditions was recognized even in the 15th century, as evidenced by his inclusion in the Tabula Medicine, compiled by Franciscans in 1416-25. The roles of healers like Adam de Betjesovers and John of St. Giles were crucial in the 13th century. They provided essential medical care to their communities and the nobility, while also offering spiritual guidance. Their work reflects the multifaceted nature of the friars' mission, combining the care of the body with the care of the soul. Geoffrey Lawn's career is primarily known through the letters of Raymond of Capua, who was the Master General of the Dominican Order from 1380 to 1399. The first mention of Lawn is in 1393, when he was assigned to teach the sentences of Peter Lombard at the Cambridge convent, a step towards earning his Doctor of Theology degree. By the end of 1395, Lawn was outside England and was given permission to return to the English province, then to Cologne, and finally to present himself to the order's procurator in Rome. In December 1396, he was granted a license to choose a brother confessor to absolve him from any excommunication for leaving his province with Raymond's authority. In February 1397, he received permission to stay at any German convent, choose his own socius and confessor, and this permission lasted until the next general chapter of the order. By 18 October 1398, Lawn's career took a significant turn. At the request of Edward, Duke of Aumale, Lawn, now a master in theology, was given permission to serve the Duke in both spiritual and temporal matters, including as his confessor. Lawn could travel with his socius, reside in any convent, and practice medicine on the Duke, his friends, and household. The order warned that anyone obstructing Lawn would lose all privileges. This unique permission highlights Lawn's dual role as both a spiritual and medical advisor to the Duke. Edward of Langley, Duke of Aumale, was the second son of Edmund, the first Duke of York, and a favorite of King Richard II. He successfully transferred his loyalty to Henry IV when Richard was dethroned. In 1402, he became the second Duke of York and died in 1415. Laun's service to the Duke likely ended before Edward's death, as he is not mentioned in the Duke's later medical record. Laun's reputation as a healer is evident in the Tabula Medicine, where he is cited under 9 different headings. One of his notable patients was John Bruyll, a successful clerical administrator who served as Dean of York. Bruyll was a notary public and worked for William Courtenay, the Bishop of London, and later the Archbishop of Canterbury. He also served in Richard II's household, and later for Henry IV, becoming the keeper of the Privy Seal from 1406 to 1415. Laun treated Bruyll for stomach ailments, including a failing appetite and digestive issues, and possibly served as his confessor. Another patient of Laun's was Sir John Trussell, a prominent gentry figure from Warwickshire. Trussell was from a family known as the Lollard Knights, though there is no evidence of his Lollard sympathies. Laun treated him for a condition resulting from excessive sexual activity, which involved an expensive remedy with ingredients like ivory shavings, pearls, coral, and emerald. Laun's expertise extended to various medical issues, including stomach problems, digestion, and even the construction of a specialized hat to treat a cold head. This hat, made of soft leather and lined with a paste of herbs and resins, was an elaborate and costly remedy, reflecting Laun's high repute among the wealthy. Laun's collaboration with the Franciscan William Home is also noteworthy. They shared a remedy for arthritic gout, a form of arthritis, which involved a mix of gums, resins, and spices. The treatment was seasonal, avoiding certain lunar phases to facilitate bloodletting. The Tabula Medicine also includes a remedy for a cold head, similar to one used by the Dominican John of St. Giles to treat the Earl of Gloucester. This connection suggests a shared tradition of medical knowledge among the Dominicans, which was later adapted and used by Laun. Laun's career as a healer and confessor in noble households was exceptional. Few other English Dominicans achieved the same level of medical training or had such high-profile patients. His presence in the Tabula Medicine and other medical texts highlights the importance of his work and the demand for practical medical knowledge within the mendicant orders of the time. The Wellcome Library MS 550 is a fascinating manuscript from the early 1400s. Written in Latin with a few passages in Middle English and Anglo-Norman, it is a collection of medical remedies and texts. The manuscript is believed to have been compiled by an English physician, possibly from London. It includes works by various authors like John of Burgundy, John of Toledo, Henry de Monville, and the Trotula. The compiler often references cases treated in London, though it's not always clear if he treated these patients himself. For example, one case describes a fistula on a leg, similar to a case treated by the surgeon John Ardern around 1370. The manuscript is more than just a collection of remedies. It also includes stories and examples to illustrate points. One such story, found at the end of a section on leprosy, tells of a countess of Flanders who cured her husband of leprosy using the herb ebulus. This kind of illustrative story, called an exemplum, is often found in sermons and preachers' handbooks. The manuscript has a strong connection to the Franciscan order. At the end, there is an index created by Brother W. Frothingham, likely a Franciscan friar. The index is organized alphabetically by the first letter and covers a wide range of illnesses and remedies. It also includes references to parts of the body and topics from both the compiled texts and the general remedy sections. The Franciscan connection goes deeper. The manuscript mentions Franciscans in 2 instances. One story describes a friar treated for throat inflammation with a plaster made of cumin and olive leaves. Another reference praises a drink of cider, recommended by the minister provincial of the Franciscans in England. This minister provincial, Nicholas Fakenham, served from 1395 to 1402, and he might be the one who recommended the cider. These connections suggest that the Wellcome MS 550 was likely compiled and used within Franciscan circles. The compiler might have been a friar with a strong interest in medicine, possibly a practitioner or someone concerned with the health of his community. An interesting case from around 1477 involves a Franciscan friar named Ulrich de Vedica from the London Grey Friars. Ulrich treated an elderly woman named Alice Steed, who was suffering from severe swelling and decaying flesh on her legs. Despite the gravity of her condition, Ulrich agreed to treat her after much persuasion. He focused on her internal ailments while recommending a surgeon for her legs. After 5 weeks of treatment, Alice felt much better and paid Ulrich 20 shillings for his services. However, Alice's husband, William Steed, sued the friars for trespass, claiming they had taken his money without his permission. This case highlights the complex legal and ethical issues surrounding medical practice by friars in medieval London. Another Franciscan, John Bruyll, who was active in the late 1300s and early 1400s, also left behind medical remedies in a manuscript. Bruyll, who served as a guardian of the London convent and later as a suffragan bishop, included various remedies in his writings. These remedies cover a range of conditions, including purgatives and treatments for dementia and skin ailments. One particularly interesting item is a charm to stop bleeding, invoking the story of Christ's baptism and crucifixion. This charm, often found in medical manuscripts, demonstrates how religious and medical practices were intertwined in medieval times. These examples show that Franciscan friars were actively involved in medical practice, often blending religious and medical knowledge in their treatments. Their work provides a unique window into the medical practices and beliefs of late medieval England. In the medieval world, the role of friars extended far beyond religious duties. This chapter sheds light on the medical practices of friars, particularly those of the Franciscan, Carmelite, and Augustinian orders in England. By examining manuscripts, annotations, and other historical records, we can piece together the fascinating ways in which these friars combined traditional medical knowledge with ritual and charm to treat a wide range of ailments. One notable figure is John Bruyll, a Franciscan friar who compiled and annotated medical texts. Bruyll copied a medical ritual from the works of Gilbertus Anglicus, a well-known source of remedies in late medieval England. This ritual, intended to promote conception, involved using comfrey to write a formula on parchment, which was then worn as an amulet during sexual intercourse. Bruyll's detailed notes suggest that he was not just a copyist, but also an active practitioner, engaged in the practical application of these rituals. Richard Tennant, a Carmelite friar, is another example of a friar deeply involved in medical practice. Tennant compiled a manuscript containing a variety of medical texts, including a lexicon of herbal names, texts on medicaments and illnesses, and methods of diagnosis from urine and pulse. His annotations, which he called experimenta, provide insights into his own medical practices. For instance, he added notes on diagnosing pregnancy from a woman's urine, recipes for plasters to treat liver overheating, and methods for using clysters and medicinal baths. One of his experimenta involved a charm to find a drowned person using a red stick anointed with the blood of a relative. These practices, combining practical medicine with ritual and charm, reflect the unorthodox and diverse nature of medieval medical knowledge. Among the Augustinian friars, Robert Waldby stands out, though his credentials as a physician are somewhat tenuous. Waldby, who became Archbishop of York, was associated with the Augustinian convent in York, which had an extensive library of medical books. While there is no direct evidence that Waldby practiced medicine, the presence of these books suggests that medical knowledge was valued within the convent. The infirmary in Augustinian houses, as outlined in the constitutions of Ratisbon, was a central part of the friars' duties, and trained friars were permitted to practice medicine both inside and outside the convent, at least until this permission was revoked in 1388. The medical practices of friars were not limited to the wealthy or noble. They treated a wide range of patients, from commoners to prominent citizens, and their treatments covered a broad spectrum of illnesses, from burns and skin complaints to more serious conditions like fevers, gynecological issues, and even surgery. Diagnosis often involved the examination of urine and the use of various experimental tests, while treatments ranged from herbal remedies and purges to prayers and charms. This holistic approach, integrating both practical and spiritual elements, was a defining feature of medieval medical practice among friars. Despite the challenges in piecing together the full extent of their medical activities, the surviving manuscripts and records reveal a rich and varied picture of friars as healers. They show that friars were not only custodians of religious knowledge, but also played a significant role in the medical care of their communities, blending traditional medical practices with ritual and charm in a way that was both practical and deeply rooted in their spiritual beliefs.